So the first thing that I keep hearing is therapists saying, oh, now it's in fashion to say that your parents are narcissists. Now, it is true that every time a new concept starts becoming popular, and we know that narcissism is the word of the year, right? It is true that there's going to be a lot of talk about it, and some of it is more qualified and some of it is less qualified. So sure, lots of people are calling people narcissists when they don't even know what narcissism is. That's absolutely true. I'm not denying that. What I'm saying is, don't throw the baby out with the bathwater. Some of these people who are talking about narcissism are discovering that they come from families where they are dealing with incredibly narcissistic parents who potentially have personality disorders. And there's a you can treat a personality disorder, not in terms of curing it, but you can get better. But if you're dealing with parents who don't care, then it's really, really, really important to help this specific demographic to understand what they can expect and how they can deal with narcissistic parents.
Hey, I'm Tari Lima, and I help adult children of narcissists individuate and build a life that's actually based on their inner compass.
So when you're just worried about all of the people that are throwing the word narcissism around without knowing what it means, you're not focusing on the people that actually need your help, which are the actual children of narcissists, the actual children of untreated cluster Bs, okay? And that is just throwing the baby out with the bathwater. That's ignoring the group of people that need this information the most. So let's talk with nuance. Like, if things aren't black and white, you can at the same time be like, people throw around the word narcissism, and there's people who really, really need information about narcissism and how it impacts you if you were raised by a narcissist and what you can do about it in a practical way now so you can actually individuate. So let's focus on what's important, even if there is a part of the conversation that's maybe not so relevant. The other thing that I keep on hearing is like, you can't diagnose your parents. Now, I will refer you to the work of trauma specialist and ex-Harvard professor Janina Fisher, who in her books describes what a diagnosis is. On the one hand, to diagnose someone is to have the legal power of signing a document with the information that someone fits a certain diagnostic criteria. But this is actually the least common form of diagnosis. Janina Fisher states, and I agree with her, that diagnosis also means that you learn how to identify a personality profile, a type of functioning, a type of psychological adaptation. So when you're saying that someone has a schizoid adaptation, for example, because you've had that person in therapy for a couple of years, or someone has a borderline adaptation or a narcissistic adaptation, you're not saying that you have the legal power to sign a document that says this. What you're saying is, I've been this person's therapist for a couple of years now. I'm noticing some very repetitive themes, and the word that describe this complex of themes and symptoms is schizoid or narcissist or borderline or whatever it is. And this is the most common form of diagnosis. So diagnosis is not always signing a document. Diagnosis is, you're a therapist, you study different personality profiles, you study different psychological issues, you study different techniques for helping people in a practical way, and you are the person who is actually dealing with the patient, and you're going to be the first person to understand, unless the patient is, self-taught and is studying and knows what their deal is, you're going to be probably one of the first people to be able to understand their profile, what psychological adaptation they have. And if you're going to diagnose someone this way, it would be super relevant for you to also be able to refer these people to specialists that are very human, who are very professional in the way that they talk about things. For example, like borderline personality disorder is highly stigmatized. But if you go on Dr. Fox's channel, it's not. You'll feel incredibly respected because he's great. He's an excellent professional, and you can find wonderful information about your specific psychological and personality adaptation with his content and with other types of content as well. So it doesn't have to be the stigmatizing thing. It's supposed to be useful and helpful. And no, you're not diagnosing someone if you're talking about a personality type.
Hey guys, if you're getting any value from this video, then download your free PDF, Break the Chains, 10 Steps to Stop Your Narcissistic Parents' Control. You can find the link in the description box.
The other thing that I keep on hearing is, well, they did the best they could. Your parents did the best they could. On the one hand, it is absolutely true that people do what they can, what's within their reach. If they could do better, they would do better. I mean, if they could consistently act better and in a mature way, they would do so, right? And it is true that people can only do what they learned, and they can only act from the psychological defense mechanisms that have been prevalent in their personalities since they were kids, unless they treat that. But the fact that this is true doesn't mean that you're not traumatized because the best that they could do was really crappy. So you're invalidating the fact that the person who is seeking therapy is not their parents, it's not the narcissistic parent, it's the adult child who is in therapy with you, right? If you're a professional, for example. And we can't just invalidate all of the consequences of the very traumatizing experience of someone else's best not being good enough for what a human being needs. And you don't have to be like, oh my God, we need to blame our parents and everything is their fault and I'm just going to be here in victim mode. It's not about being in victim mode. The only way of really feeling powerful in life is if you focus on what you can control and you accept radically what you can't control. And it is a therapist's job as well to teach children of narcissists who often are suffering with learned helplessness how to do this in practice. But you can't do this if you invalidate decades of abuse and neglect, because, well, your parents did what they could. Great. And what about the consequences of what they did? How do I deal with that? So that's what we should focus on. Okay, they did what they could. That's fine. Now, what do I do with all of this? Please help me with this. The other thing is, a lot of people are like, you have to forgive your parent. Just take, be the bigger man. Be the bigger man. Forgive your parents. And I would argue, again, on the one hand, you can definitely feel compassion for someone else's limitations. I remember that I am the child of a narcissistic mother. I remember when I learned about narcissism, I understood immediately that it was a form of complex post-traumatic stress disorder, and that she had developed in this way from when she was a child, and that she had no hope of acting differently, until she decided to get treatment or something, which she didn't. And the thing is, once I understood that, I felt this tremendous compassion for her, and I was able to see her as a child who just couldn't do any better. And I kind of put myself in the adult position. I eventually went no contact with her because it's just too much. And if the other person is not getting treatment, and if they're not healing, and they're constantly blaming you for everything, that's not a healthy relationship, right? And I wanted to be healthy. I wanted to find out who I was. And so that's why I went no contact with her. But I was able to forgive her limitations. I was able to be like, I'm not even in a position to be controlling other people, so it's not up to me to tell people, oh, you can't be a narcissist, oh, you can't be this, you can't be that. If you want to get treatment, that's on you, but I understand that she can't do better right now, until she wakes up, if she wakes up. And in that sense, you can forgive someone. But we gotta, even if that's what you're talking about when you're talking about forgiveness, that's a process. You can't just be like, forgive your parents. Oh, okay, I guess they're forgiven now, but you're still dealing with all the trauma, all of the resentments, all of the pain, all of the guilt and confusion and the sense of inadequacy. It doesn't work that way. You have to work up towards forgiveness. And I would also argue that the first point of therapy isn't forgiving other people, it's forgiving yourself, man. Because when you were raised by narcissistic people, you were taught to deactivate your self-protection instinct and your path back to your true self. And then you gave up your values, not even having a chance to figure out what they were. And now you find yourself in the adult phase having made all sorts of choices that don't reflect who you are. And sometimes we feel resentment and anger towards ourselves. It's like, how could I be so dumb? How could I not notice? Why did I marry this guy? Just because he was rich and my mom wanted him as a son-in-law. Why did I choose this career path that my dad wanted for me? So oftentimes we feel really dumb when we find out that we're the children of narcissists and that we've created this whole life sometimes that does not reflect our true values at all. So the purpose of therapy in this case is for you to forgive yourself. Forgive your past selves for decisions that they made with the distorted reality perception that they had at the time. I mean, if you could have done better, you would have. And that's where the focus of forgiveness needs to be. It's about self-compassion. It's about forgiving what you couldn't have done better. Treating yourself with a sort of grace that you're not used to receiving from your parents. You know what I'm saying? That's the focus of forgiveness when you're dealing with children of narcissists. And I would also argue that a lot of people think forgiveness means just forget the past so we can carry on with business as usual. I'm sorry, but that is literally just normalizing abuse and neglect and just telling people, just suck it up. It doesn't work that way, man. If forgiveness for you means, let's just forget anything ever happened and then I could just do the same thing tomorrow, that obviously is not going to work to help create any sort of healthy relationship. You're not teaching people healthy boundaries at all, and forgiveness cannot mean that. Does that make sense? Another thing that I hear a lot is, I remember in Brazil when I was looking for therapy to deal with this issue involving my mom, and back in the day, you couldn't find therapists. It was almost impossible for you to find anyone who would validate, one, the existence of narcissism, two, that parents could be narcissistic, because in Brazil people think that if you have children you automatically are incredibly loving and everything you do is because you love them deeply, and that you couldn't possibly have a personality disorder or be an incredibly abusive person. It's like this crazy blind spot where some therapists, obviously not all of them, but back in the day it was almost all of them, honestly. They would look at like TV and there would be these horrible stories about, mothers and fathers that did these abusive things to their children. And they'd be like, oh my God, that alternate reality where stuff like that happens is really horrible. And they would look at it almost as if it was like this distant thing that wasn't real. But if you went up to them and were like, I went through that, they were absolutely incapable of validating that those parents exist in real life. So it's a very big blind spot when you come from cultures where you just have to obey your parents. People had a really hard time understanding that some parents were mentally ill, or they had personality disorders or issues, whatever sorts of issues. They were emotionally mature and they were not therefore available or attuned to the child's needs. Because of that, when I tried to look for therapy, and I tried some who were psychologists and others who were like holistic therapists and followed alternative methods, I tried all sorts of stuff. People kept on interrupting me, and I could tell that they were getting triggered. They were just really uncomfortable with what I was saying about my mom, and they wouldn't let me even explain what I was saying. They'd be like, but she did the best she could, but you really shouldn't speak like that about your mom. And I was like, but so why is this wrong? Why is it wrong to interrupt your patient? I mean, it should be obvious, but why is it wrong? Because what's actually happening is you're not understanding that you're dealing with your own countertransference. So countertransferences in psychoanalysis is when you have a trigger. You get emotionally triggered and you actually act from that trigger, which is often like trauma of your own that you need to deal with. And as therapists, we need to be aware of when we're getting triggered by a patient so that we don't project that onto them and try to kind of impose our way of thinking onto them. That's something that you gotta deal with in your therapy sessions, right? Or with whatever self-therapeutic technique that you use. You have to, as a therapist, you have to be able to identify when you're getting triggered. Because when you get triggered, you're actually having an implicit memory, which is a type of memory that is already very automated in your system. It happens like, at the drop of a hat, and you become kind of dissociated at that moment. You're not really connected to reality anymore. You're back in your trauma state. And this is not what people are paying a therapist for them to be triggered and for them to not be able to manage that. So if you notice that you're trying to tell a therapist something that's really important to you and they literally can't listen to you because they're triggered, it's okay. I mean, we're all humans. I'm not saying, therapists, you have to be robots. That's not the issue. It's just that it's like a really basic thing in therapy where if you are a therapist, you need to understand when you're triggered. And you can't be projecting that stuff onto your patients. The other thing I hear is that people just assume that families should always be united, as if it were inherently horrible for families not to be together. And obviously that's not true. I deal with lots of patients who had people in the family who were pedophiles. And maybe some other members of the family kind of knew about it, but everyone was worried about the appearance, or they would call the kid a slut, even if the kid was like 4 years old, and they would blame the kid. It's this horrible story. And then everyone's like, but you gotta keep the family together. You gotta keep the family together. Not only is it completely disrespectful and re-traumatizing to that child who is going to be an adult and is going to have to interact with their abuser all the time in family gatherings and pretend everything is okay. But when you keep the family together, you're also exposing other people to the same type of abuse. Like, I've had so many clients who then would have children, and because the family forced them to, and they didn't know how to set boundaries, they would expose these children to the same pedophiles that they were exposed to. So it makes no sense for you to think that, if someone, contributed with eggs or sperm, then they are always wishing for the best that you could possibly have, and it's always healthy to be close to them. No, it's not. It's a case-by-case situation, and we need to be very wise about this. Sometimes people aren't the healthiest when they are together. And sometimes they're the healthiest when they allow themselves to go low contact or no contact or gray rock or yellow rock or whatever method you're using. Do you understand? And there's another thing as well. When you're like, oh, but it's your family, but you got to be close to your family. You're also assuming that your family wants to be close to you. When it comes to my mom specifically, she discarded all of us for years. She didn't want us in her life. She oftentimes will tell us, I have no interest in the person you are. If you hadn't come out of me, I would have no contact with you. So she went no contact. And she did this with our biological family as well in Brazil. She moved to another country and she went no contact with them. So it's not always the case that the mother or the father wants to be in contact with the children. And when you're like, oh, you have to fight for this contact because, you know, family should be together, you're putting the person in a really weird situation. What are they going to do about the fact that they're being discarded by their own parents? So it's not black and white. The other thing is people saying, oh, that's just family, you know, families like that, that's normal. And I don't know who it was that said this, but there's this saying, to adapt to a sick world is not a sign of health. So there's a lot of really crappy things that were normalized in families throughout the world, such as this idea that children were little monsters that needed to have their essence beaten out of them so that they could blindly obey adults. Such as this idea that you can never say no to your parents. So that's just inherently pathological. And for you to say, well, I know it's inherently pathological and it's not good for anyone, but you know what? It's common. So just keep at it. Makes literally no sense. So we can't think about it like that. It doesn't matter if something is common. We have to ask ourselves if it makes sense and if it is aligned with our inner compass. Because if it's not, then I don't care what's common. We should move towards something that makes sense. And the other thing that I keep on hearing is, well, you know, you can't do that because you feel guilty. Whenever I hear a story about a therapist who tells the child of a narcissist or an untreated cluster B or an addict or someone with an untreated mood disorder, you know, whatever sort of deal it is, whenever I hear someone telling the children of these individuals that you can't set boundaries or go low contact or no contact because you feel guilt, I'm like, you're literally confessing to the world that you don't know how to deal with your own guilt. And so you're imposing this limitation that you have onto your client or your patient, you know, depending on the sort of deal that you do. And, you know, there's that saying, everything you want is on the other side of fear. I would add that everything you want is on the other side of guilt, fear, and shame. So we often try to do things and we feel so much guilt, so much shame. And it's not because it's wrong for us, it's because our family system works as an emotional unit and they need you to play your role, because when you leave, when you try to individuate, the whole unit gets shaky and then they don't know what to do about it. So they pressure you through guilt tripping, through fear and through shame to come back to your old role and not rock the boat. So in this particular case, you are going to feel guilt in most cases. You're going to feel fear, you're going to feel shame, but you got to keep treading, because if your entire life is darkness and you see this little beacon of light and it's like this dim little light, but you know it's pointing you in the right direction, and as you walk towards it, your family starts acting out and they kind of try to pressure you through guilt to come back to the system. And if you keep trying and going back and trying and going back and trying and going back, you're going to get so depressed, because it's going to feel that nothing you do ever helps you to break free. The only way to break free is to keep on treading. Feel the guilt, feel the fear, feel the shame, man. Just keep on treading towards that light. The light has got to be something that your inner compass chose for you, not your family or society. It's got to be that direction that your inner compass is telling you need to go towards. Don't you want to individuate? You can't individuate if you don't follow your specific little subjective inner compass. When you're dealing with toxic families, you need to help people move through the fear. Keep on treading, keep on treading, keep on treading. When you finally get to that light, you're going to look back and be like, I cannot believe I survived in that family for so many decades. I'm never going back. Because obviously being an autonomous, individuated adult is a hell of a lot better than being the scared little child that feels they can't do anything that the family disapproves of. Ooh, okay, so I guess there's a lot more to be said about this, but I'm gonna stop there because I don't want the video to be too long, and it's already like 25 minutes long. Let me know if any of these things are things you've heard about in your culture, in your family, in, you know, when you try to seek therapy. Obviously, there's lots of other stories where people are like, God, my therapist was wonderful. They were the ones who alerted me about narcissism, about this or about that. And because of them, I was able to individuate. That's wonderful. I hope we have more and more therapists who are actually specialized in this field, because it's really, really dangerous to tell people, go back to your family, go back to your family, you know? And not everyone's gonna go no contact, but you definitely have to teach people how to get to know their inner compass and follow it so they can set healthy enough boundaries for them to survive and be able to individuate. Okay. That's all I wanted to say about this subject. Let me know how these words impacted you in the comments below. I love hearing your feedback. I really do, reading your feedback. Okay, that's it, ladies and gents. Have a lovely day.